A very good morning to all. Once again, we are with a new video. The content of this video is age factor for medical coding. Okay, so after completing our graduation, many of us we will be doing our profession, like whatever category it may be, we will be trying our profession, and when we don't feel like we are succeeding in that, so we will be trying some other professions, right? So in this case, after 27 or 28 years, if you are trying into a medical coding field, that is a complete flop. Okay, because nowadays companies in India, they are recruiting candidates those who are below 27 years. So when you are approaching an academy, first thing, like when you ask them, I'm 30 years old now, can I approach for this course? They will tell, surely you can join for this course only. They won't tell you the criteria, like after completing this you won't get job, that things and all will not be discussed. But before that, before whatever course it may be, either it is medical coding or some other course, before you enroll for a training program, just Google and see like what are the negative side of this, what are the positive side of this. Whenever you're searching it, age factor is the first important thing which is mainly listed, because in the companies in India, they are recruiting candidates only below 27 years. Okay, and that is one thing. Even after you complete this medical coding, or if you have completed your CPC certification exam and you are above 30 years or above 27 years, it is a very difficult task to get you a job. Okay, because companies will not take. In that case, you should like we are doing this placements, that time most of the candidates, those who are approaching us, are above 30, like 30, 31 years, like that. Okay, the candidates will be in that age. Even if we suggest them some job, or if we are getting them some job, like in medical coding only, these people have a specific request, like I don't want to do HCC coding, I want to get into only CPT coding. See, being a fresher, not only for above 27 years candidate, I'm telling for everybody, being a CPC certified fresher, you should have you should enter into the job, either it may be HCC coding, or it may be CPT coding, or it is IP coding. It all depends upon your knowledge level and how you are clearing the interview. That is one factor. But what you have to keep in your mind is, being a fresher, you should gain experience in whatever sector, like either it is HCC coding, or it is IP coding, or it is CPT coding, whatever it may be. So being a fresher, you have to gain your experience. After 1 year or after 2 years, you can change, like you can change your specialty, or you can work. But year by year your age is going on. Okay, so after clearing your CPC certification, if you have certain specification, like I will work only in this company, I will do only this project, that will take you in a negative side only. So being a fresher, don't have any such specification, or don't go behind that. Whatever being a fresher, like in whatever company you get job as a medical coder, just join and do it. That is one request. And coming again to the age factor, when you are approaching an academy, just ask them, like I'm about 27 years, okay, whether I will get job if I'm completing the CPC certification, because for training alone it will cost you some 25 to 30,000, and for exam it will be costing you around 65,000. So overall it will come around some 1 lakh. Okay, so you are investing something into a course. So 1 lakh you are investing into your course, and your time, especially your time also. So it will take almost 3 or 4 months for you to understand the concept of medical coding and to clear your exam. So if you are wasting all your time and money and everything, whether it is worth it, that you have to understand. That you should talk to your academy trainer in person. You have to talk to her or him. Just ask them, like, after completing my CPC exam, will I get job in this age? If they say yes, means they can assure you a job, right? That's why they are telling you yes. So make sure they will get you the job. That is one thing. And after completing your CPC certification, suppose after 30 years if you are not getting a job, don't regret for it. Okay, go. Many training academies are there. They are taking certified professionals for this training program. So you can try in that sector also. It's not like you should work only as a medical coder. Clinical analyst is there. It all depends on your graduation. Okay, before, like in 2015, 2014 and all, mainly they were taking only nursing, medical graduates, physiotherapists. They were very particular about that graduation. But after that, everything was changed, and all graduates, like whether it is life science or non-life science, all the people were entering into this field. But again, now it is again changed, and the company is having a specification like only medical graduates can apply for this, only nursing or physiotherapist can apply for this. Like that, they are having the specifications. So before entering into coding, make sure you are from a life science category. Okay, that is one thing. And second thing is your age. You should be from a life science category. Second category, your age. You should be below 27 years to join as a fresher in a medical coding field. Third thing, make sure you're clearing your CPC exam before you enter into your work, because companies will require only CPC certified people. Non-certified also they will get job, but there will be training period for you again 3 months, and in that terminations will be there. So that like it's like wastage of time. So again joining in a company, taking 3 months of training, you can utilize that to clear your CPC exam and get into a very good job role. That is what I can say. So first thing, you should be from a life science category. Second thing, you should be below 27 years, and third thing, you should clear your CPC exam before you try your job. That is third thing. And fourth thing, what I have to say is, don't have any sort of specification like I will work only with this company, I won't work with that company, I will choose only this project. Don't have, being a fresher, don't have any such thoughts in your mind. If you are getting a job, accept it with full heart, join to the work, give your 100%, work confidently, work like what to say, learn something. It is also a project only. Nowadays I am hearing like many candidates, they are telling I don't want to do HCC project. In India, majority companies, they are doing only HCC. If you say no to HCC, means then what are you waiting for? Then why you have written your CPC, why you have invested your money in this? So being for freshers only I am telling, not for experienced candidates. Being a fresher, if you are getting job in HCC, accept it, learn that HCC project for 1 year. Okay, in US and all, I have students from US, like those who have completed their CPC, now they are looking for CRC, because there all the hospitals are means they are asking for CRC certification. So don't think it is a waste project or it is not used and all. It is required, and you can earn high in this sector also. So if you are being a fresher, if you are getting into HCC, accept it, work, give your 100% and work. Okay, so learn that HCC project completely. Next year you can change to some IP, in that IP or E&M or surgery coding, whatever it may be. Again you will be considered as fresher only. No worries, learn that also. Okay, so you will be having everything in your hand, no? That's what you have to understand. So again I am summarizing it. First thing, before choosing medical coding as your career path, understand your age is an important factor. You should be below 27 years to choose this as your career path. So that thing, that is the important thing I want to say here. And in India only age is below 27 years, okay. In UAE and all, age is not a factor. But again, I want to say you one thing, in UAE also, from last 2022 middle onwards, they have started taking only experienced candidates. Freshers are not allowed. Okay, so throw that from your mind. Like being a fresher, I can go to UAE and I can start working. Don't do that. Gain at least 2 or 3 years of experience from India and then go and work in UAE. That will be good, because again taking visiting visa, going there, searching job, it is very difficult task, unless and otherwise you are a medical professional. If you are a doctor, I won't say it is easy. If you are a doctor and if you are CPC certified, being a fresher, you will get job. Apart from that, other category people, it is difficult only. So try to understand. Age is an important factor. So before choosing medical coding, think 100 times, like your age, that thing you have to keep in your mind, okay. If you are below 27 only, get into medical coding, otherwise don't do. That is a request, okay. So that's all. And you can comment below, like whatever questions you have, you can comment below. Before that, please do like, and if you find it useful, please do share it with your friends. Thank you so much. Thank you for watching my video.